So one of the fascinating things in our field is the way genetics is really taken over. And pre-implantation genetic screening, PGS, also interchangeably sometimes used with PGD or pre-implantation genetic diagnosis, however they're completely different. What PGS is it's a way of testing an embryo to make sure that it's chromosomally normal. And that differentiates from PGD, which is pre-implantation genetic diagnosis, which is really looking for a genetic disorder in that embryo, so a gene defect. And so with most of our patients these days, we are doing PGS, or pre-implantation genetic screening. And essentially what we do there is we take a few cells from the embryo. And we take a few of those cells, we're able to get a karyotype, so basically a chromosomal analysis of the embryo, which is really fairly fascinating because when you or I get a karyotype done, we go to the lab, they draw some blood from our arm, they're getting millions of red blood cells to get that karyotype. From an embryo, we don't have millions of cells. So we have to take just a few, usually 2, 3, 4 cells from the embryo, and we can get the same result. And what a karyotype is it's looking at the chromosomes of the embryo. There are 23 pairs of chromosomes if you count X and Y as a pair. So there are 22 what we call autosomes, and then there are 2 X's to make a female or an X and a Y that would make up a male. And with the PGS, what we're able to do is look to make sure the embryo is chromosomally normal. The testing is getting so precise now that we're actually able to pick up other things. So not only are we picking up that there's an extra chromosome or that a chromosome is missing, but we can actually pick up smaller deletions or smaller additions in that chromosome that would cause an abnormality. We can also pick up translocations where there's a part of the chromosome that's kind of turned or on a separate chromosome, so it's misplaced. So we usually recommend either PGS or PGD for different reasons. So PGS or pre-implantation genetic screening is recommended in order to look at the total chromosomal complement of the embryo just to make sure it's chromosomally normal. And this will help patients who are older to select the normal embryos that we can put in, and this would rule out embryos that are chromosomally abnormal. The chromosomal abnormal embryos would either end in a miscarriage or create an embryo that's not going to create a pregnancy, so a negative pregnancy test, or potentially the most common chromosomal abnormality that would rule out is Down syndrome. And so it does eliminate Down syndrome risk for patients as well. Now, pre-implantation genetic diagnosis is a little bit different. This will look for a specific gene. So as I said before, there are 23 pairs of chromosomes, but on those 23 pairs of chromosomes, there are 35,000 genes. So you can have a genetic abnormality or a gene disorder, and that can be propagated in the offspring. So for instance, if you're a carrier for cystic fibrosis or Tay-Sachs disease or thalassemia, and the egg and the sperm are both carriers for the same disorder, you can then have a baby with that disorder. With pre-implantation genetic diagnosis, we're able to look at those embryos and pick out the embryos that are abnormal.